All right, back on the morning drive. Quick look at your weather. It's 71 degrees outside. It's going to be very hot today. 99 your expected high. The heat index will be hotter than that, so please take all the necessary precautions. Take care of your plants and your dogs and your kids and old folks. Everybody that needs some help, make sure they get some help because it's going to be very hot this weekend. 101 your expected high tomorrow. So hopefully the start of next week we'll have somewhat cooler temperatures, but very hot outside this weekend. So, South Georgia summertime, so nothing we're not used to here in Lowndes County. Joining us this morning, we're very glad to have Randy Sauls in the studio with us. He's the CEO of South Georgia Medical Center. And, Randy, good morning. Good to see you.
Well, good morning. Appreciate you having me.
Absolutely. And, of course, we talked a lot this morning, as has everybody else in the free world, about the decision yesterday by the Supreme Court to uphold the Affordable Care Act legislation. Let me ask you, first of all, were you surprised by the decision yesterday?
Well, actually, I was, just from hearing the arguments and the oral arguments in the presentation and, of course, the comments from our own State Attorney General recanting when his last visit to Valdosta about the oral arguments. He was there, and so the way the justices were behaving during the oral arguments, I was a little bit surprised that they took the approach that they took.
And of course, the question that I'm sure has been posed to you and that everybody talks about is, okay, exactly what does this mean for me? Because I said this earlier, I think probably 99% of the people in this country have no idea the enormity of the bill and everything that's in the bill, and it's a very complex piece of legislation.
Well, we downloaded the brief yesterday from the justices, 193 pages, so we have not had time to plow through it. Implementation is what we don't know. We know what the justices said, that they struck down or upheld the mandate that individuals purchase private health insurance, and that would be considered a tax. But how that's done and implemented, that's yet to be determined. I don't know how that's going to be done.
Mm-hmm. And, of course, South Georgia Medical Center is and I may be terming incorrectly, not-for-profit or non-profit hospital. What's the exact terminology?
We're a not-for-profit public hospital. We're an authority hospital, actually. We're one of the oldest forms of hospitals, organizations in Georgia, under the authority laws of Georgia. So we treat anybody and everybody without regardless of anything. Of course, we're not-for-profit. Doesn't mean that we're not for loss.
Right.
So
we hope not.
We hope not, yes. But we do treat anybody without regardless, and we certainly follow all the meaningful collection practices and eligibility practices that you would expect a not-for-profit public hospital to follow relative to determining eligibility for services.
Now, the Medicare portion of this, that seems to be one of the biggest issues for hospitals like yourself, because I don't know what the numbers are, but certainly you treat a lot of those patients, and so how those payments are done, that's going to be a big issue. Right.
Right now, Medicare represents about 40% of our volume in terms of dollar volume at the medical center, about 20% Medicaid, and then around 20% commercial insurance. The rest is self-pay type programs. But Medicare, the baby boomers, those born between 1946 and 1964, started turning 65 last year and became eligible. And they're becoming eligible today at the rate of 7,000 a day.
Wow.
So that's the number of enrollees in the Medicare population that are eligible for Medicare benefits beginning as of last year.
That's a big chunk.
Yeah, and it certainly is Valdosta, Lowndes County, South Georgia is a desirable place for retirees to move and live and play. We're seeing the number of retirees and eligible Medicare recipients somewhat expand to some degree.
And so I guess as you talk about waiting to see what the implementation is that part of it, waiting to see exactly what happens with that Medicare part of it?
Well, the Medicare program is a age eligibility piece.
Right.
So they're constantly modifying and managing the mechanism of the payment to hospitals through Medicare at any given time.
Gotcha.
We're constantly in and out of alerts and what's covered, what's not covered, eligibility requirements, co-payments, deductible changes relative to the Medicare program. That's something we've been used to since the 1960s when Medicare was put in place. What's happening now, just the sheer volume of Medicaid eligible beneficiaries is what's growing.
Gotcha. Of course, Randy, you've been the CEO since last year, but you've been with South Georgia Medical Center since 2000. And before that, you were, I know, with Lewis Smith Hospital and also the center over in Lakeland. So you've been both the CEO of how many employees again at South Georgia Medical Center?
About 3,000 Social Security numbers.
And also you've been with the smaller hospitals as well. And I know we're seeing the trend of consolidation when it comes to healthcare. Talk a little bit about how that's affected South Georgia Medical Center and really the healthcare industry as a whole.
Well, Chris, you are seeing consolidation, and the reason you're seeing consolidation, there's quite a bit of overhead and capital investment to manage hospitals, advanced imaging, surgery programs, a lot of fixed cost. The smaller hospitals are having a harder time to carry that burden based on the volume of patients that they see and their limited resources. So very often patients may be treated urgently, maybe emergently in the small hospitals to be transferred for their advanced care to the tertiary centers like South Georgia Medical Center. So you are seeing the smaller hospitals under continued pressure to be able to keep up, if you will, based on where they're located regionally in the state, generally in the rural communities, but also the ability for them to keep up with the same level of services. Another problem that we talk about in the rural communities, when you recruit physicians, of course, if you're not from that community, it's hard to recruit into that community very often. When towns like Valdosta are so appealing relative to the communities. So we work real hard to make the hospitals in the rural communities attractive, well-furnished and well-equipped, well-staffed, so that those physicians will at least look at those community hospitals and be a part of those small towns.
Now, I've heard mentioned several times in the news the shortage of physicians coming out now. Has that been a real problem for South Georgia Medical Center, and is it a problem nationwide?
It is a problem for South Georgia Medical Center around some specialties. It is a problem across the nation, and we've seen a shift in the way medical education is done in the United States in terms of how medical students are selected in residencies and fellowships and that sort of thing. The primary care specialties have been the ones the most effective. Most young people, when they go to medical school, want to go into a specialty or subspecialty. So we have seen a shift away from primary care, and there are basically 5 primary care areas that have been affected. Of course, family medicine, internal medicine, general surgery, OBGYN. Those tend to be the ones that are affected most by the shift in the preferences of young people going to specialties and subspecialties.
Well, I know that's always a challenge to recruit those individuals like you talk about, but I tell you what, I put the folks here up against anybody's because we've got some great physicians here and medical personnel on all stages, and also the technology, which I know changes daily maybe in the healthcare industry, but South Georgia Medical Center has done a good job of kind of staying out in front of the curve, it seems.
Right. We have had a long history of having an outstanding medical community and having outstanding medical leaders in our medical community to attract and retain high-quality physicians to not only their practices but to start new services in our community and have excellent oversight and management. And that's a legacy that Valdosta's had for a long, long time. And clearly the medical care here is second to none. It really is world-class. And I get to see that and witness that through the men and women who are physicians. I often tell people hospitals don't admit patients, physicians do. And we have to remember that physicians are the reason that the hospitals are there. Obviously, the demand for patient services and so forth causes that to happen, but by having high-quality physicians who are really engaged in the governance of the hospital and concerned about the activities within the hospital, resources, that's very, very important to have a good balance, and we certainly have that here in Valdosta.
And I would imagine, and again, this is from a layman's point of view, but I would imagine it's a pretty big advantage for you guys as well to have such a great nursing program like we have at Valdosta State University, because I'm sure it's a great field to get into. I know there's a lot of people go into that field, and the need is there. Again, you talk about the aging population. Healthcare industries is one that is going to be there to take care of them.
That's right. The average age of nurse in Georgia right now is 47 years old, and our affiliation with Valdosta State University for many years now, producing high-quality nursing graduates, not only for Valdosta, but throughout the region, and of course, both nationally and internationally. We're very fortunate. Not only do we affiliate with Valdosta State University, we also affiliate with Wiregrass Technical College, in addition to numerous other Georgia colleges and universities within the Drive region of South Georgia. Many of those nurses are on our campuses doing their clinical rotations, and even some of the North Florida community colleges access South Georgia for the same types of clinical activities.
Just makes it a good picture all the way around.
It does.
And, again, we're joined this morning by CEO of South Georgia Medical Center, Randy Sauls. And you mentioned something, a statistic to me earlier about the percentage of Americans who don't have health coverage, and I found that really high.
Right. We just locally, Chris, about 25% of working adults in South Georgia, this is where we live, do not have health insurance.
Wow.
That means they're at risk for calamities in life, and not only economic catastrophes, but limitations on access to health care outside the emergency room environment. So that is a cause for concern for us as we see these patients. We treat anybody, but there's appropriate care and inappropriate care, and sometimes episodic care that could have been managed earlier. And because they have lacked access to health care, they feel that being a barrier to getting appropriate care. And so that's a concern for not only nationally, but for right here where we live in South Georgia.
And I guess that's just a byproduct of the economy the way it is?
It is a byproduct of the economy. We've actually seen our indigent care, those patients that don't have health care, are self-employed or self-insured or just don't have access, we've seen that creep up as well, from about 3% several years ago to most recent numbers about 11% at the medical center right now.
And that's, again, you guys, if they show up, you guys treat them. I mean, that's your purpose, that's your mission. But that indigent care write-off, that's a big number.
It is a big number, and it's a number that we can manage and have historically managed. But shifting that burden around from those other payers who are paying is getting more and more difficult. And we manage that, of course, every month at our medical center. And it's something that we need to watch, as not only as a hospital, but our industry is watching it as well.
Yeah. Well, again, I think that's going to be, as this health care law is implemented and as it goes on, if it does go on, I think those are the kind of numbers we're going to see possibly change. And, again, you guys are always having to, people who use the emergency room as their doctor, which is not a good idea. And I know people, and you guys, I know, streamline that process as much as possible, but still that becomes an issue for folks. So
Right. We see about 65,000 patients a year at the main campus. About 20,000 patients a year on the Smith Northview campus just for the emergency room alone.
Yeah.
And, of course, we're there for anybody and for any reason. But we would like to see patients access and have a primary care provider. That was the ideal way, and hopefully this bill will accommodate that to some degree. I don't know all the details and how that will happen exactly, but certainly it does give, on the surface, an opportunity to try to address that problem.
Yeah, I don't know if anybody knows that exactly yet, and that's the best situation, not just for the hospital, but for the health of the person. I mean, to have that primary care physician, that preventative care can save you a lot down on the back end. So that's why I obviously that's the best way to go.
Right. I think people don't really understand the health insurance and the need for it. I talk to young people from time to time and ask them about that when I teach college classes and things, and there's a disconnect between what it does and how you purchase it. So they don't really realize what it is that they're purchasing or buying. They think many things often are free, and there's not a cost to it. But it is not overly unaffordable when you can go out to Yahoo and, for instance, Google Georgia health insurance, and you'll get all the licensed companies in Georgia advertising, and you can click on for a certain age group, and from time to time you can click on an individual policy, and you can say, well, it's not really unaffordable. It's just I don't want to go through the process of applying and all those things, and so I think we need to do this. If it's doing one thing, this bill is educating Americans about how health care is paid for in America.
And they're 20 and 21 years old, and they think they're going to live forever. They don't need that right now.
That's right.
Then they get married and have kids, and they think differently. So
that's right. That's right.
Randy, we appreciate your time this morning. I know it's always the field of healthcare is always changing with new challenges and new opportunities as well. I know, of course, with Smith Northview, that consolidation, it seems like it's going extremely well. I've heard nothing but good reports from both sides. So.
It has. We've been real pleased with that staff and that medical staff, and they've made it so pleasurable for all of us involved, and they continue to treat patients every day and doing a great job.
Yeah, so, Randy, good to see you. Thanks for your time this morning.
My pleasure.
Randy Sauls, CEO of South Georgia Medical Center. We appreciate his joining us, and again, the picture of healthcare in America changed a lot yesterday. Will that remain? Again, a lot of that may determine what happens in November. We'll just have to wait and see. Sam Owens will be joining us, the Attorney General for the state of Georgia, next hour to get his thoughts on the legal part. Of course, he's been part of that a challenge to that, and we'll get his views on that next hour. We'll take a break right now. I'll come right back with another look at your weather and a lot more right after this. You're listening to The Morning Drive on News Talk 105.9. This is WVGA.